Medical Monday with Dr. Ninan, a thoracic surgeon. We are talking about lung cancer. We're talking about cancers of the esophagus. Getting a lot of great information from Dr. Ninan. Thank you so very much. We're going to hop right back to the phones because you guys are asking the best questions. And Juanita is on the line. Juanita, thank you for your patience. Whew, you might want to turn down that TV just a hair. Go ahead with your question.
Yes, my question is that I went to my doctor and they sent me to a lung doctor because I have a real bad cough it's real thick, kind of yellowish, kind of flame comes up, and it doesn't happen all the time. It's basically like early in the morning or something like that. And my doctor said that it's something that's indigenous to this part of the country and of the state, and that it's not cancerous, and that we should just continue to check it every so often and just make sure that it's not growing. But my question is could it possibly turn into a cancer, and is it realistic for me to speak to my doctor about going on and removing it now before it turns into something that might kill me?
So that's actually a very good question, because this is a very common issue that we have here in Tennessee. So if you look at the river valleys of both the Ohio River and the Tennessee River, we do have a high incidence of a fungal infection called histoplasmosis in this region. And this causes lung problems. It causes nodules in the lung. It can cause masses in the lung. It can cause lymph nodal enlargement in the chest. It can even be picked up on a PET scan, which we use to sometimes diagnose cancer. So we have learned as specialists as to how to try and differentiate this from this being a cancer. Now, traditionally, histoplasmosis has not been treated by surgical methods, and there is no evidence that it causes cancer or puts you at higher risk for cancer. So a lot of the time we don't really need to remove all the disease of histoplasmosis to make you well. A lot of the time the body is able to control it by itself. If it is not, then we may have to do a biopsy to diagnose it, and then we treat it with medications. So I think that's what your doctor is implying, that when he or she looked at it on the scan, it looked more like a histoplasmosis, and they did not want to proceed to a lung cancer workup and diagnosis.
Okay, Juanita, thank you for your call tonight. We appreciate you calling in. We have Jack, who wrote in on Facebook, and he said he smoked for 20 years, but he quit 2 years ago. So way to go, Jack. But he's worried about what kind of signs should he be looking for when it comes to lung cancer.
Now, it will depend on how much Jack has smoked for those 20 years. So, you know, the way we calculate the whole smoking burden of somebody is to look at what we call pack years. And for example, if you've smoked 1 pack a day for 20 years, you've done 20 into 1, 20 pack years. But if you've smoked 3 packs a day for 20 years, so that's 60 pack years. So once you start to get beyond 55 to 60 pack years of smoking, then your incidence of lung cancer goes up pretty dramatically. So when we do this new thing that we are now looking at very carefully, and that is how to screen patients for lung cancer using special types of CT scans. We look at patients who've had more and more pack years of smoking, at least like a 55 pack year smoking history. So I think that one, if Jack has had a large number of pack years, then he should at least consider getting a screening scan. And that your primary care doctor can refer you for that. It's a low dose CT scan that now most insurances pay for, and they check you for once a year for like 3 years and see that nothing shows up in your lung during that time. The other issue is that all those symptoms that I was talking about. Cough is a big symptom. Bringing up some blood is another symptom. Chest pain that's localized to like a side of the chest, or your shortness of breath that is worse than what your standard COPD is. Those are all symptoms, but unfortunately they suggest a slightly later stage of lung cancer. So our idea is to catch this earlier and earlier.
Right.
And those that have a strong smoking history need to consider screening for lung cancer.
And you said the CT scan is the way to go. So
Yes.
you need to plan on once a year, right?
Yes. And your primary care physician can point you in the direction of a radiology center that does these screening scans. And these screening scans are slightly different from your standard CT scan.
How so?
For the standard CT scan, we use a lot more radiation for the scan. This is a low radiation. It's slightly more than a chest X-ray, but it gives you, and it's much quicker and it's cheaper to do, and it is obviously an outpatient procedure. You just go in and have it, and they are able to detect cancers much better than just doing a chest X-ray for you. So this is, talking to your primary care doctor whether you fit into the category that would benefit from screening, etc. And I think over the next few years you're going to see a lot more institutions here in Nashville talk about screening for lung cancer. The idea is being to catch you early.
You told me something very interesting in the break that I had never considered. The lung does not have nerves, so it does not feel pain.
Correct. So, that is why we have no symptoms often in the early stages of lung cancer. And that is why we need an imaging modality like a CT scan to show us that there is
To
something
say, hey,
going on.
something's wrong.
Something is wrong here. And once we see things like that, there are a lot of patients that may have nodules in the lung from histoplasmosis or something that is totally benign. So we need to be able to look at it and say, okay, these are the people that have a higher risk, and this looks more like cancer as opposed to something that's more benign. And there are systems that we have in place to be able to differentiate these two, etc. But it's often something that your specialist has to do.
Very good. Let's get to Tom. He's been waiting ever so patiently. Tom, what's your question tonight?
My question is, I have COPD, and I read in the magazine that they're trying stem cell. I was wondering what's his opinion on stem cell.
Now, stem cell transplantation for what we call lung failure is an emerging discipline. We still haven't gotten to the stage where it is clinically relevant. So as far as I'm aware, there is nobody offering you a treatment right now that has been proven to increase your lung function. So what happens is that, especially if you've had a long-term history of smoking, etc., you get this condition called COPD that all of you have seen on TV, advertised. But in some patients, that can progress to what we call lung failure, meaning that just like your heart fails and it cannot pump very well anymore, the lung fails and it cannot give you oxygenation and release the carbon dioxide from your blood. So in those patients, traditionally they've just been treated with oxygen therapy and other medications, for a longer time, and they just somehow manage with that. The patients who are very badly affected by that, we can offer lung transplantation to a few of those patients. But what do we do with those patients that are in that category where medication is not making much? So there has been a lot of research going on into this, and one way might be to try and repopulate the lung with good cells that will exchange these gases for you. And that is why these kind of treatments have come up. But unfortunately, we haven't reached a stage whereby we can inject or somehow deliver those cells into the lung so that the lung will take it up and repopulate the lung with good cells. So I'm afraid that's a few years away, and maybe in the future we don't need to do big time surgeries for these kind of issues, and you don't need to take a lot of different kinds of medications. Maybe we can treat it with these emerging technologies.
Is that really on the forefront of research right now, the stem cell therapy?
Yes, stem cell and a lot of other therapies. There are multiple research efforts that are going on towards lung disease all around the world, because if you look at the world as a whole, the burden that lung disease puts on the healthcare system is huge. And a lot of patients are repeatedly coming into the ER for treatments. They're getting pneumonias and being admitted in the hospital and staying in the ICU. They get complications after other forms of surgery. So the overall burden internationally is huge. And so there's a lot of work going on in this area.
Okay. When we come back, I want to talk about treatments for both lung cancer and esophageal cancer. And of course, we'll take more of your phone calls if you have them as well. So stay with us.